So today we're going to talk about something that on the surface seems totally routine, a hip injection. But when you dig a little deeper, you find this really powerful story about empathy and paying attention to the little things. It's all about how one simple action can completely change how a patient feels. So let's dive in. I mean, really think about that for a second. It's a question pretty much all of us have asked ourselves, right? Usually right as we're bracing for a shot. We just assume injections are supposed to hurt, at least a little. But what if they don't have to? What if a little bit of care could totally change that? That's the big idea we're exploring today. Okay, so first things first, let's set the scene. We are talking about one of the most common things that happens in hospitals and clinics all over the world, the intramuscular injection. And when I say common, I mean the scale is just staggering. We're talking millions of these injections every single day. So this isn't some rare, complicated surgery, it's a basic, fundamental part of healthcare. And honestly, that's exactly why improving the experience, even just a tiny bit, can have such a huge, massive impact. So what exactly is an IMIM, or intramuscular injection? Let's break down the basics of what's going on here. Well, the name kind of gives it away, right? Intramuscular just means into the muscle. And the reason we do this is because our muscles have a really great blood supply. That means any medicine delivered there gets absorbed into our system fast. It's just a super direct, super efficient way to get medication where it needs to go. And I'm willing to bet you've had one. This is how we get a lot of common vaccines, powerful antibiotics, hormone treatments, and even certain kinds of pain meds. It really is a cornerstone of modern medicine. But for all the good it does, we have to talk about the elephant in the room from the patient's side of things, the pain. And believe me, this is the central challenge that doctors and nurses are always trying to figure out. In fact, the source material we're looking at, which is a clinical training guide, basically boils its entire purpose down to this one simple, crucial question. It's not just about how do we get the medicine in, it's about how do we do it in the kindest, most comfortable way possible. That question right there is really at the heart of what better patient care is all about. So what's the answer? Well, you might be surprised. It's not some fancy high-tech gadget or a brand new drug. No, it's something wonderfully simple, an insight that comes from a really practical, hands-on place. And what's so cool about this is that the guide points to this super low-tech, almost common-sense trick for dealing with the pain. It's a great reminder that sometimes the absolute best solutions are the simple ones we might have just overlooked. And here it is. This is the golden nugget. Tucked away in the Hindi commentary of a clinical training video is this amazing piece of advice. Just use ice. A simple piece of ice applied to the spot to numb it before the needle goes in. It's just a brilliant example of how practical wisdom can pop up anywhere, It goes beyond language or formal textbooks. So the whole procedure with this little improvement looks like this. Step 1, the nurse finds the right spot on the hip. Step 2, and this is the game changer, they apply ice to numb the area. And then finally, step 3, they administer the injection. It's simple, it's effective, and it's completely focused on the patient. So how does a simple little act like this fit into the bigger picture of the whole healthcare team? I mean, who's actually responsible for what? It really comes down to coordination. And it really is a team effort. You've got the doctor who's looking at the big picture. They make the diagnosis, prescribe the medicine, and set the overall plan. But then you have the nurse, who's right there on the front lines. They're the one actually giving the injection and, crucially, managing the patient's direct comfort. They're the one who would think to grab that piece of ice. All right, so after looking at the procedure, the problem, and this really elegant solution, what's the big takeaway here? What does this one simple hip injection teach us about healthcare in general? It all comes down to this. In the world of medicine, which can feel really complex and kind of intimidating sometimes, tiny acts of empathy matter a lot. Taking just a few extra seconds to apply a bit of ice isn't just about making it hurt less. It sends a message to the patient. It tells them that their comfort matters, that they're being cared for as a person, not just treated like another procedure. So that leaves us with a pretty big question, right? If something as simple as a piece of ice can totally transform a routine injection, what other small, thoughtful acts are just waiting out there to be discovered? What else could redefine the patient experience in other parts of medicine? It's definitely something to think about.